All right. Dr. Vasquez, most people I know keep forgetting some of the three major illnesses which are out there: glaucoma, macular degeneration, cataract. What the heck are they doing, and how dangerous or not so dangerous is one or the other one? You know, kind of how can you detect that you might possibly have one, and if you do, what can be done, and all that type of stuff, and how dangerous is it in terms of losing your vision totally? So let's just go fast over all three effects a little bit here.
Okay. So first with glaucoma, one way to detect it is through checking the eye pressure of the eyes and also evaluating the optic nerve of the eyes. And so that's how you would detect the eyes.
How does the patient detect it? How does the patient get perhaps a feeling of like, wait a minute, something may be wrong? How does he know?
You really don't. Unless it's a very high pressure within the eyes, that's the only way the patient will find out that they have glaucoma. Most times it's just on a routine eye exam.
But don't you
screenings that they do.
Don't you get blind from glaucoma?
You can if it's undiagnosed and untreated. You can go completely blind with glaucoma.
Okay, so that would be a symptom, wouldn't it? Which the patient recognizes.
Right. It's going to be sudden. Yeah, sudden loss of vision, that's not usually a good sign.
I see. So glaucoma comes sudden.
Some forms of glaucoma can come sudden, yes. There are, close to 10 types of forms of glaucoma based on different parts of the what's happening within the eye. The most popular one is open-angle glaucoma, which is a very slow process, which you can treat with eye drops and some surgical methods. So the more acute phases, because of eye infections or other stuff, increases the pressure very rapidly, and that causes a lot of pain and discomfort, and that's usually what bring the person in, and then you have to do more testing and other therapies.
Okay. So, all right, good. So is glaucoma treatable? All those 21, so they're all treatable?
They can all be treated, whether it be drops, surgical methods, other things like that. So they can all be treated. Yeah. Okay.
Vision restored.
Depending on how long this pressure has been up so much, then most times the vision can be restored. But a lot of times, if it hasn't been treated and just gone by the wayside, it may not be treated. It may not be vision restored.
I see. So it's like with a tooth. Once the tooth has fallen out, it has fallen out.
Exactly.
Where yet before that, the dentist can pretty much fix it all the time.
That's right.
Okay. So that's a good reason to go and get checked, I suppose. All right. Next one. Macular degeneration.
Macular degeneration, some early signs of that is blurriness when looking at people's faces or looking at the TV or trying to fill out a checkbook. A little bit of blurriness in those situations. It affects your central vision. That's one of the early signs of that.
I see. How does a person know the difference between not filling out his checkbook, it being just old age nearsightedness, or macular degeneration?
Through their annual eye exams, by looking at the eye doctor, like myself, looking at the retina of the eye, looking at your macula, and finding out if there are some problems happening in those situations. So you have to, start checking things off. Why is it because of this? Did the glasses improve your vision? Okay, that works fine. Did it not improve your vision? And then we looked at the retina, we looked at their macula, and we found little spots on the eye, and then your blurry vision's coming from degeneration of the macula. So it can be a rule of exclusion, trying to find out what's happening.
See, so what I'm hearing here, Dr. Vasquez, that some of the symptoms themselves may be present in many different illnesses, but not necessarily mean the same.
That's right. There's masqueraders that may lead you down one path, but it's actually something else. That's right.
Right. I guess like it is in the whole body. I mean, you can get dizzy, and it may be for one or on 500 different reasons, and some might just be like very temporarily, whatever. Maybe you didn't eat the whole day and you got a little whatever, and the other one may be you have a serious circulation problem or whatever.
That's right. Yeah,
I got it. Yep. Good. Third one, cataracts.
Cataracts. Cataracts, it can affect some of the everyday activities, like maybe reading. But most times people come in with a complaint of glare at night. The nighttime driving gets to be a big problem. You start to see a lot of halos, starburst, and creates a decrease in your vision in those situations. And then we just say, well, okay, it's kind of tough to see at night, or it's all that glare. I just don't feel comfortable driving. But then in the daytime, it's fine. You don't notice it. So that's usually the chief complaints is the glare from the cataracts. And then as the cataracts develop, then it starts to affect your daily activities like reading, going to the grocery store, reading your Bible, reading your newspaper, sometimes even eating. I like to eat, so hopefully I can find out that right away so I can eat a lot.
Okay. And I don't think we forgot to ask in terms of the macular degeneration, but stay with the cataracts. So, if it is there, is it treatable?
You can slow down the process of cataracts. Once the yellowing has happening or the cracking of the lens has happened, you can't turn it back, but you can try and slow it down by wearing UV protected lenses. That also can help, slow down the process of macular degeneration. And then you get into supplements like antioxidants, like vitamin C, vitamin E, can help slow down the process of cataracts, and then antioxidants for the macular degeneration too. So there's ways that you can help slow it down, but then if it develops to a point where you are losing some vision and it is affecting your everyday things, then there's surgical methods that you can do with the cataract. Take the lens out that's opacified and then put an implant in, and then everything's clear again. So if treatable, getting rid of it altogether, it's there's different ways on that.
So first it's slowing it down if it's not too bad. If it gets too bad for whatever reason, surgery is still an option.
Correct. Yeah.
And then you see normal again. Then the film that blurriness is gone.
That's right. Yeah, it clears it all up.
Dangerous operation? Yes. No.
Yeah. I mean,
it's an operation.
It's an operation, so there are risks. I would say dangerous. But I mean, there's risk to any surgery. But work on your eyes. There are some complications that have gone, that have occurred. So you got to be informed.
Okay, good. All right. So basically, macular degeneration, glaucoma, and cataracts, they all can be stopped in the track, especially if they have been found relatively early. Yes?
That's correct. Yes.
And
you can all.
Yeah.
Go. You can treat all of those types of conditions.
Okay, good. And surgery is available for almost all of them, even in advanced stages, and still can be done. Yes?
Yes. Macular degeneration is the one surgery that happens on a wet form, where there's bleeding happening on your macula. And usually at that point, your vision is quite reduced, not able to be restored, but there's a surgical method that can help improve the quality of vision, but not to 100%. So you can, get 20% improvement in your vision just on some of those surgical methods of macular degeneration.
I see. Okay. Nevertheless, all three of them, if detected relatively early with annual or at least every couple of year type of examination, most of the time that's enough to drastically slow them down, fix them, and not ever get them all that bad, right?
That's correct, yeah. Maintaining the eye health is very important, and early detection is important too.
Okay. And none of those three illnesses has anything to do whether you use originally one way or the other way see good far or not far or nearsighted or whatever. That's a whole different ballgame. You just simply don't see far, and you take glasses, lenses, or whatever it may be for that, or laser surgery for the farsightedness, right? I mean, for the...
Right,
yeah. Okay.
You're looking at medical part of it versus refractive part of it. So the nearsighted, farsighted, presbyopia, that's refractive.
And that's something which is besides of the illnesses the eye can have, which might then destroy it.
That's right, yeah. And so you have to pinpoint all those different needs of the eye and then make sure that you're getting the right protection.
Okay, good. So if I go skiing this weekend, I actually should wear sunglasses because I'm 58 and I've never worn sunglasses in my life, and I do ski a fair amount.
Yeah, you should have some type of polarized sunglasses on because you can get the snow blindness. You can get an inflammation of the eyes from the glare coming off the snow.
Well, maybe I never got it. Maybe I never got it so far because my head is always in the snow. It's always my feet which are up and my head is down.
Maybe you're not going fast enough.
No, maybe I'm going too fast.
Okay.
I'm always in the snow. All right. Anyway, okay. I'm sure this information helped. At least it has helped me, and I hope it does help the viewers also. Bye-bye, Dr. Vasquez. Speak to you in a while.